Hello, my name is Elena Wachter, and I am an exercise science major with a concentration in occupational therapy at Westchester University. Today I'm going to be talking about cerebral palsy and the exercise prescription I would recommend to someone who has this condition from the research I've done on this project and the references I have gathered that you will see at the end of the presentation. So in order to even start an exercise prescription, you have to understand what the condition is before you start a prescription. So what is cerebral palsy? It is a group of neurological disorders that appear in infancy and early childhood, and it permanently affects the body's movement and muscle coordination. It is caused by damage to or abnormalities inside the developing brain, and it specifically affects the cerebral cortex. The cerebral refers to the brain, and palsy refers to the loss or impairment of motor function. The damage is not repairable, and the disabilities that result are permanent. So there is no known cure, and the only way to treat it is through treatment. So there would be no cure. The signs and symptoms. Infants with cerebral palsy usually have a developmental delay, and they're slower to reach developmental milestones. So in order to see that if your child would have this, a baby that is younger than 6 months of age would have his head lag when you pick him up while he's lying on his back. He feels stiff, he feels floppy. When you pick him up, his legs get stiff and they cross or they scissor. And then in a baby older than 6 months of age, you would be able to see that they don't roll over in either direction. They cannot bring their hands together. They have difficulty bringing their hands to their mouth. They reach out with only one hand while keeping the other like fisted. And then in a baby older than 10 months of age, you would see that they would crawl in a lopsided manner, pushing off with one hand and leg while dragging the opposite hand and leg. And they cannot stand unless holding on to support. And damage can occur before, during, or shortly after birth. And like I said, the signs and symptoms usually appear in the early months of life. A specific diagnosis may be delayed until 2 years old or later on in life. They can have a hypotonia, which they can appear relaxed or even floppy in this criteria, or they can appear hypertonia, which would be stiff or rigid, so the opposite. A majority of children who are diagnosed are born with cerebral palsy, and many cases are unknown as to the cause, so they're born with it. So here are some specific forms of cerebral palsy. Patients can either have spastic cerebral palsy, which is the most common, where people have stiff muscles and awkward movements. And then there's like 3 concentrations of it, if that's, yeah. So you can have spastic hemiplegia or hemiparesis, which affects the arm and hand on one side, but it can also include the legs. Spastic diplegia or diparesis involves muscle stiffness and affects specifically the legs. It's less severely affecting the arms and the face, and the hands may be clumsy. Spastic quadriplegia or quadriparesis is the most severe and is associated with moderate to severe intellectual disability or severe stiffness in their limbs and a floppy neck. Then there's athetoid cerebral palsy, which is involuntary or uncontrolled movements in the extremities. There's dyskinetic cerebral palsy, which is slow and uncontrollable writhing movements of the hands, arms, feet, or legs. There's ataxic cerebral palsy, which affects mainly balance and depth perception, and patients with this will have poor coordination. And then there's also mixed types of cerebral palsy. So any of the ones I've said previously can be a mix of those symptoms and not just specifically one. So the diagnosis, so a doctor would monitor the child's motor skills, developmental growth, muscle tone, motor control, hearing, vision, posture, and coordination. They will also order a series of tests to evaluate the child's motor skills and other things that could possibly be causing these symptoms associated with cerebral palsy. So they're basically just ruling everything else out that isn't cerebral palsy. And although symptoms may change over time, cerebral palsy is not progressive. If a child is continuously losing motor skills, the problem more likely is a condition other than cerebral palsy, such as like a genetic or muscle disease, a metabolism disorder, or tumors in the motor system. So this is something else that they're going to be looking for. So if all the lab tests come back normal and it's not coming up as anything but cerebral palsy, they will also order neuroimaging techniques. These can include cranial ultrasounds, which is going to look at the white matter in their brain, computed tomography or a CT scan, which are x-rays to create images that show the brain in areas of the damage, and a magnetic resonance imaging, which is an MRI, which is a magnetic field and radio waves to show the location and type of damage in the brain. So this is going to be a lot more specific to cerebral palsy and is going to show where it's affecting the child's brain. Then there's also an electro program, which detects changes in the electrical activity in the brain. Treatment. So like I said before, this unfortunately cannot be cured, but treatment can help improve the child's capabilities. So they would most likely be seeing physical therapy, occupational therapy, recreation therapy, and speech and language therapy. So the physical therapy would be there to improve muscle strength, balance, and motor skills. Occupational therapy will help with everyday activities. Physical therapy or recreational therapy helps with participation in art and cultural program and sport, and that will also see improvement in speech, self-esteem, and emotional well-being. And they can also have speech and language therapy, which improves a child's ability to communicate and swallow. Common medications seen with people who have cerebral palsy can be oral medications to relax stiff, contracted, or overactive muscles, and the side effects to those could be drowsiness, changes in blood pressure, and risk of liver damage. And then I have the types of medications that can be taken orally, which include diazepam, baclofen, dantrolene, sodium, and tizanidine. It's appropriate for those who only need a mild reduction in muscle tone or widespread spasticity. There's also botulinum toxin, or BTA, which is an injection for overactive muscles and for children with spastic movement disorders. This is effective with a flexibility program, but a side effect can be an occasional mild flu-like symptoms. There's also intrathecal baclofen therapy, which uses an implantable pump to deliver baclofen to the fluid surrounding the spinal cord. It's a muscle relaxant, so it's appropriate to those with severe stiffness or uncontrolled muscle movements in the body. So the effects of exercise on cerebral palsy: those who exercise regularly do have an improved mobility and quality of life and a reduced risk of chronic conditions, which include diabetes and cardiovascular disease. They also maintain muscle length and strength. They maintain bone density levels and exercise their cardiorespiratory system to maintain strength and fitness levels. Those with low fitness levels develop chronic pain, fatigue, and osteoporosis. Strength training will see upper and lower limb strength improvements. Aerobic training will see improvements in oxygen uptake and blood hemoglobin. So, some special considerations: change the program consistently with changes in muscle tone, rehabilitation, and medical interventions for your patient. They should have good positioning of the head, trunk, and proximal joints during the entire exercise program. Patients with cerebral palsy are more susceptible to overuse injuries, so please be aware of this when you are training a client. This is due to inactivity, and other conditions can also include joint pain, so if they're experiencing that, please be cautious. We should always start an exercise program slowly for them so they can get in the hang of it. They also have reduced cardiorespiratory endurance, so they might not be able to perform at the same level as other children their age. Motor limitations, functional classification, we should also keep in mind. It's on a 1 to 8 scale based on the patient's ability to perform self-initiated movement accurately. So an 8 is minimally affected and a 1 is severely affected in all 4 limbs. So 8, you're going to have the least effect of cerebral palsy on you. 1, you will have the most. So here's our case study. We have a 15-year-old male adolescent with spastic cerebral palsy. His risk stratification is he has motor limitations and overuse injuries can occur in this patient. His risk group, he has a functional classification of 6. His goals is to improve mobility, and any specific or any special considerations with regards to exercise response include moderate to severe quadriplegia, ambulance with walking aids, less coordination, balance problems when running or throwing, and has greater upper extremity involvement. Exercise testing. So when we first meet the client, we are going to do 2 submaximal level tests, which include a 6-minute walk test for exercise tolerance and an arm crank protocol to see where his arms are at. We're going to do a 10-minute shuttle run test to identify performance limiting factors to exercise capability. We're going to do progressive maximal cycle ergometer tests to assess peak oxygen consumption and muscle power sprint tests to assess anaerobic performance and agility. This will all uncover challenges to regular physical activity to identify our risks for our client. We can prescribe appropriate exercise intensity from these exercise tests, and symptom-limited graded exercise testing is not required to begin an exercise program for this patient. Exercise prescriptions. So with this patient, we are using our FIT principle. Our FIT principle for patients with cerebral palsy is limited because we don't have a lot of literature on those with cerebral palsy, so we can consider the same principles as the general population with modifications to the training protocol as needing and as we see fit for our patient. So our aerobic training for our patient would be, our frequency would be daily, at least 5 days per week. Intensity, we would start at 40 to 59% his heart rate reserve and then increase it to 60 to 89% as needed. His time should be a part of his at least 60 minutes per day of exercise. And his type should be enjoyable and developmentally appropriate activities such as running, biking, swimming, dancing, and sports. Resistance training, this frequency should be at least 3 days per week. His intensity he should use his body weight as a resistance or 8 to 15 of his submaximal repetitions of an exercise to the point of fatigue with good mechanical form. His time should also be included in that 60 minutes per day of exercise. His type should be muscle strengthening, physical activities that can be unstructured or structured. Unstructured would consist of climbing, tug of war, playing on playground equipment. Structured would be consisting of lifting weights or working with resistance bands. To continue off of that, bone strengthening should be done at least 3 days per week. There's no really intensity for it, but it should also be a part of that 60 minutes per day of exercise. And as long as you're doing those resistance training exercises, you would also be helping your bone strengthening. Flexibility should be done at least 2 to 3 days per week, with daily being the most effective. You should stretch to the point of feeling tightness or slight discomfort and hold that for at least 10 to 30 seconds. Type should be a series of flexibility exercises for each of the major muscle tendon units, and this should be done when the muscles are warm. In conclusion, exercise training to develop muscular strength and endurance are valuable in hindering the functional deterioration of cerebral palsy. Exercise is a key factor in helping improve limitations patients with cerebral palsy have, and cerebral palsy cannot be cured, but it can be treated and improvements can be made through exercise. And then here are the references for